Hello, it's Melissa Sweet here, public health journalist from Croakey blog. We're just about to kick off our first act of walking journalism in Melbourne, a Croakey Go. Hello Daniel James, nice to see you, and the National Rural Health Alliance joining us online as well. Before we begin, we'd like to acknowledge that we're on the country of the Wurundjeri people of the Kulin Nation, and we're gathering here at Rushall Station, and it's lovely to see a really good turnout of people. Some people we know from Twitter, some people we know from real life, and some people who are new for us at Croakey. So we're just going to do some quick introductions to find out who's walking with us today. So could you please introduce yourself?
My name is Emmanuel, and I'm Nigerian. I'm a master's student of public health, and I was told about the work, and I'm kind of like having an interest in public health, and get to just learn new stuff, new things, and probably apply it to my education as well.
Great. And are there any particular health matters on your mind this week? What are you?
Well, currently I'm working on reproductive health.
Right.
Back in school, so any new ideas that could help out in tackling, most especially there's like an initiative in my country that I'm currently criticizing. So
okay, so we'll be talking maybe about reproductive health
as
we go.
Yeah,
thank you very much.
My name is Francis from Ghana. I'm in ACU doing public health in global health and advocacy. I heard about this very work from a lecturer in ACU, and I decided to join today. As you know, I'm a doctor by profession. I came here to study public health so I could acquire more knowledge to help my people back in Ghana. And this week I have on my mind the major problem in Ghana is infant mortality, which the rate is very high, and I decided to learn much more about how this is being managed in Australia, so that when I go back home I can apply the knowledge to curtail this kind of problem in my country.
Thank you very much. Infant mortality. What are you hearing more about?
Hello, I'm Jen. I'm a healthcare safety and quality researcher at the University of Melbourne. This week, because a personal experience on my mind has been the new triage system that Ambulance Victoria has put in place, and the effect that has on people who are presenting with rare emergencies that might not be identified as such until it's a bit too late. So that's my thing today.
So can we talk more about that?
We can, yes.
Hello, Helen.
Hi, Helen Schultz, psychiatrist in Melbourne. Beautiful sunny day in Melbourne, thank goodness. I'm here today pretty much to represent doctors and doctors in training around mental health issues in the medical profession, particularly in the area of mandatory reporting and what's been happening in that space, as well as I suppose too the other big issue that we're recognising at the moment is our own safety in the health profession after losing a colleague in a very tragic way in Melbourne recently.
Thank you, Helen, and we'll be coming back to talk to you.
Thank you.
Hello, Marie.
Hi, I'm Marie Bismarck. I'm a researcher at the University of Melbourne, and I work part-time with Origin Youth Health as a psychiatry registrar. I've been thinking lots this week about the well-being of the patients I look after and how that connects with the well-being of the doctors and nurses and allied health who look after our patients, and how we can make a stronger connection between caring for the well-being of our health workforce and supporting the well-being of our patients.
Thank you very much.
Hi, Carmela Ferraro. I work part-time with Doctors for the Environment Australia, but I'm here just to enjoy the sun and a whole bunch of people interested in health and journalism. This week my thoughts have been very much around coal and the hazards around that and the health impacts and the disconnect between what we do with our daily lives and how coal is impacting on us. And we seem to divide, have a pocket around how we use energy in our homes and how we get, transport to work, and we're not sort of packing it all in one place and sort of saying, well, this is how actually we're using this stuff and this is how it's impacting on us. So how we drive that disconnect closer is something that I'm sort of working hard to do.
Thank you very much, Kamala.
Thanks,
we always appreciate your contributions to Croakey.
Thank you.
Hello.
Hello, Melissa. I'm Ian. I am, amongst other things, a community journalist with Joy 94.9, the LGTBI station. We have a nightly news and current affairs show. This week we were covering, which was relevant to health, smoking rates, very high rates in the LGTBI population. So other things have been done, not done. the impact of the sexual assault report in universities, and also, of course, same-sex marriage, which just comes up time and time again. My interests are really in policy, community involvement, also around depression and anxieties, and work with Beyond Blue. And I'm at my local neighbourhood, and it's nice to see so many people.
Well, thank you. It's such a beautiful neighbourhood too. It's a lovely introduction for us to it. Hello, Philip. Could you introduce yourself?
Yes, I'm Philip Clark. I'm the Director of Health Policy at Melbourne University, and I work in sort of the area of health economics. Most sort of recently, I suppose, been doing some work in Indigenous health, looking at trying to target or be able to develop tools to target the people who are in the greatest need in terms of their cardiovascular risk.
Thank you very much, and we'll hopefully hear more about that too later today. Mitchell Ward.
I'm Mitchell Ward, the Creative Director and Web Developer at Croakey. As far as health goes, I mean, apart from walking today, which is a great thing, my main concern at the moment is I've read lately about the climate change statistics, and that we may well be reaching a tipping point, whether we like it or not, over the next I guess 5 to 10 years, and that I find that quite disturbing. And I think, as far as politicians goes, I think that they've been sitting on their hands so long on this that they must not have any hands left. So that's all I'd like to say, and that goes out to you too, the Prime Minister.
Thank you. Christina.
Hi, I'm Christina Loshard. I'm the Communications Manager at the Lowacha Institute, Australia's National Institute for Aboriginal and Torres Strait Islander Health Research. It's been a very busy fortnight, and as we prepare to launch a publication which is essentially a 20th year anniversary of our organisation since it was established in 1997. The publication highlights and demonstrates the absolute centrality of Aboriginal and Torres Strait Islander culture and leadership in health research and health decisions.
Thank you so much for coming out, Christina. We know it's a very busy time for you, so thank you. Therese.
Hi, I'm Doreen Riley. I'm Senior Research Fellow at the Australian Prevention Partnership Centre at the Sachs Institute, and I'm co-leading a national initiative working with a range of communities around Australia on chronic disease prevention. Why I'm here today, I think there's nothing better than learning about communities and understanding communities when you're in communities. So thanks for the opportunity, Croakey.
Oh, we're really glad you came. Thank you. Hello, Darren.
Hi, I'm Darren Luann. I'm a keen walker and a Northcote resident, and I'm particularly interested in the role of walking in community and in broader public health. I'm also interested in walking as a way of engaging with important public issues like homelessness, which we may well encounter on this very walk, and it's National Homelessness Week this coming week, so that's why I'm here.
Thank you very much. We're really hoping to talk to you more about National Homelessness Week, and we'd also like to thank you for recently guest tweeting for We Public Health.
No worries.
It was really a terrific week. Thank you. Monica.
Hello, Melissa. I'm Monica. I'm a friend and family, supporter of Croakey, which is a fantastic blog. If we didn't have it, I would know so much less about public health. I'm here today to go for a walk to try and shake my bronchitis, which many people in Melbourne have at the moment. So thank you for the opportunity.
Well, thank you for coming out when you're not feeling 100%, and also thank you. You were one of the very generous donors to and supporters of Just Justice, so it's lovely to see you in person.
It's a pleasure.
Say thank you. And Murray McInerney, who did all the work organising this walk.
There was such a lot of walk.
Thank you.
Stepped it out. That was a really onerous thing to do. Yeah, I'm Murray McInerney. I work with Melissa at Croakey. We've had a great couple of days with you in town doing some planning for a few more Croakey projects, but it's great to be here, and I think everybody needs to get going, so I'll be really quick and just say my focus this week I think is what's happening in Manus and the terrible transcript that's come out from Trump and Turnbull, and where discussions are so much about the politics and the strategic whatevers instead of about what impact it has on mental and physical health of the people that are being held there. So I'll be thinking of that as we walk.
Thank you, Murray. And now there's other people here we haven't talked to. Where is Daniel?
They're overcharging phones, so maybe we'll get them at the end.
Okay, well, there are some other walkers who aren't on this Periscope, but we will catch them later, and that is Daniel and Raph Clements. Thank you very much.
Pleasure.